Alrighty, so now that we've talked about the supplemental nursing system, which is for babies who need increased volume, we will talk about the special needs feeder, which is for babies with palate abnormalities, lip abnormalities, that cause them to need a little bit of a deeper latch, more assistance with that. So this little kit looks like this. It will come with a bottle, this little valve, a nipple, and then a little ring. So to assemble it, we'll go ahead and put this little disc like this. We want that little nub down. Then, it's kind of hard without a table. Would recommend using a table. Put this little nipple on top. Then we're gonna go ahead and screw it all together. Then from here, go ahead and squeeze. This is the easiest way to do it. While you're pinching, flip it. And then you'll just kind of see how the nipple fills up with fluid. So once the nipple is filled with fluid, you can kind of use this to use your math, measure how much input your baby needs. I want to say that these hold about 15 mils. Some of them are measured. Sometimes they're not though. So once we get our fluid filled up, we're going to take a peek at the front part of the nipple. I'm not sure if you can see it really well in the video, but it has a slit. The direction of the slit while feeding will determine how fast the flow is. So we will start with horizontal. So this is horizontal. It's barely anything that comes out. If I would really have a baby sucking, I would maybe get something out, but like this, pretty much don't get anything. Then we have diagonal, kind of a little bit of a drop like that. And then I'll show you vertical. They're hard to see, so I have to squeeze it usually to figure it out. So this is vertical. So that's a good solid flow. I would recommend most of the babies that probably need this need a diagonal or a vertical flow. If you have a low blood sugar baby, I would just recommend using the vertical flow, decreasing the amount of energy that's needed to get that milk. When you are using this bottle, it's just the same as paste bottle feeding with any other baby. We want to stop every 5 mils or so to give them a break. You can do upright feeding if you're not battling blood sugars or anything like that. I would recommend this as the first choice. But if you are worried about blood sugars or they're a little gaggy, kind of struggling, you can just put them on their side, laying in their bassinet on your arm, kind of horizontally like this. You again want to fill the nipple up, diminishing as much air as possible. And then this special feeder will just kind of let them get a good grip like that, deeper in their mouth, whereas a regular bottle, they'd kind of just be sucking right on the end there. This kind of usually covers up that palate abnormality, and that is what we'd use the special needs feeder for.